All right, Matt, thank you. Well, with every new phase of the pandemic come new questions, and the new guidelines from the CDC today that we talked about a little earlier raise several. So joining us now to field some of them is Dr. David Banach of UConn Health. Dr. Banach, thanks for spending a few minutes with us. We always appreciate it when you come on with us. First, let's hit the highlights of the new guidelines for us. It sounds like people who are fully vaccinated with other people who are fully vaccinated can gather relatively normally.
Right. So their updated guidance from CDC really focuses on activities of vaccinated people. So individuals who have been vaccinated, can congregate in small gatherings with other individuals who have also been vaccinated without using the physical distancing and masking measures.
There's also new guidance saying that that people who are fully vaccinated can gather with people who are not vaccinated as long as they are considered low risk for severe disease. What would that mean?
So that's a really important point. So when we look at vaccinated individuals, and that's all based on the premise that we know that vaccine really protects against transmitting infection, but it's not foolproof, right? So there is a small risk there. That someone who's vaccinated could potentially be asymptomatic, so not have symptoms and infect others. So that's why when we're looking at mixed groups where one individual is vaccinated around another individual who's not, there's that possibility that the vaccinated individual could potentially be asymptomatic and spread infection to the unvaccinated person. So if that unvaccinated person is someone who has a high risk, say older age, other medical conditions, that kind of situation should be avoided without the preventive measures like the distancing and the masking. So in that kind of mixed situation, really the best thing is for everyone to be wearing masks and maintaining that distancing. Really the flexibility of being able to meet up with people who are without wearing masks and without distancing really focuses in on those groups where both parties are fully vaccinated. And by fully vaccinated, important to remember that's at least 2 weeks from the second dose for the Moderna and the Pfizer vaccines and the first dose for the J&J vaccine.
And as you say, a small risk remains even after you've been vaccinated. And yet, Dr. Banach, this has to be happening because the vaccinations are working well. It seems like I've read the vaccines are actually outperforming the efficacy rates that came out of the trials.
Oh, absolutely. I mean, we're getting so much promising data coming to show that, we knew from the trials that the vaccine was protective against individuals becoming sick who've been vaccinated. So we felt really reassured by that. But even protecting against spreading the virus, now more and more data is coming out. There's data from Israel to show that the vaccine really protects against asymptomatic infection, so preventing transmission from people who don't have symptoms. So this is all really encouraging and really means that, we all got to get vaccinated, and that's going to be really critical in reducing the spread of infection. So, vaccines work in terms of preventing people from becoming sick, but really now we have that data to show that they're very effective in preventing spread. Again, there's no 100% guarantee on this one, but they dramatically improve the chances of spreading the virus, even if you don't have symptoms.
It leads pretty well into my last question here, and that is the numbers we've been given all along for so-called herd immunity, or 60 to 80% of the population vaccinated. Is it possible we could see herd immunity with a smaller percentage of people vaccinated?
So, I think, the herd immunity question, I think needs to be reassessed. We based herd immunity on the idea that individuals, if we get a certain percent of the population vaccinated, there won't be that risk and we'll be able to drive down transmission overall. But knowing that these vaccines are protective against not just people becoming sick, but also preventing spread of infection, I think we have to start to take that into account when we look at our overall goals in terms of reducing virus spread. So, I think the herd immunity piece is there, but, I think having this context of knowing how effective the vaccines are in preventing virus spread, I think we have to start factoring that into the equation when we start to think about the future and, what we're looking at. Again, the goal is, really, if we can get as many people vaccinated as possible, that's going to protect people, but also drive down the rate of virus spread in the community. And that's going to be so critical moving forward. So, even just re-emphasizing the importance of getting vaccinated to protect yourself and protecting all those around you.
All right, Dr. David Banach of UConn Health, thanks again for joining us. As always, you shed so much light on these issues. We appreciate it.
All right, thanks for having me on.